in my country, we have the patient involvement in two of our committees. In one of the committee for medicinal product for children and adolescents, and we also involving the patients in our committee for off-label use medicinal product.
Yeah, I'm a father of a Duchenne man. He's 20 years old now, and we've been involved for 20 years in engaging and trying to collaborate with other stakeholders like industry and research. So Duchenne has been a field very lucky because it was something like a frontier land. So we've been able to participate very much, and we've been reviewing the entire process of trial. So working on consensus, informed consensus, working on the protocol design. So we've been very lucky in participating in this process. So we hope to be able to enlarge the opportunities for other patients through EUAPTI.
Well, our experience is very specific because I'm part of Fighting Blindness, which is a patient-led organisation that funds research into rare forms and now more chronic forms of blindness. So we have founded and funded research for over 30 years, and that research is leading to from the lab, it's going from the lab into the development phase. And it's very important for patients to be involved in the processes that are surrounding that. For example, developing the infrastructure. And one of the key things that we are involved with now is the development of registers. And patients and their organisations need to be strongly involved in that area for similar reasons, because it's complex. But it's also something that can be achieved if people work together with other stakeholders. It's very important that we have those frameworks, because at the end of the day, we want to identify the patients that have the conditions that hopefully will go on to appropriate clinical trials, and then ultimately a broader group of patients will have access to the emerging therapies that we hope that will come from all of that work.
Yeah, the one we often talk about in the Health Research Board, for example, is Fighting Blindness, for example. They've been on a road now for 20 plus years, and have effectively managed to, steer research funding in the direction of their particular agenda, which is an excellent example of patient groups effectively influencing how research is conducted and where the resources are allocated.
So as a parent of a child with a complex condition, I think you enter into the world of charities. You obviously join the most relevant association, and therefore you become a willing member of that association. And so I've organised family weekends, and I've sat on various committees, and you really are a bit of a do-gooder. What can I do to help? And I write articles for the Charities magazine. However, coming on the EUAPTI course is going to help me become more knowledgeable, focused, and hopefully a more enabling member of the Tuberous Sclerosis Association, but also thinking about a wider role as a patient advocate.
Coming from Austria and working for an Austrian ethics committee, I cannot give an actual example of patient involvement. We are not that far yet. I can say that the rules of how a ethics committee should be constituted in Austria does open the possibility for patient involvement. We explicitly have to involve an organization representing patients. Unfortunately, or currently right now, this is not a patient organization. In order to do that, we would need, as I said before, this common body of patients we can address.
In Germany, as a patient advocate, I'm myself involved into a new alliance, which is more or less a partnership between the community oncologists, the clinicians from the big university hospitals, and all the other parties being involved in leukemia patient care. And we're bringing together all the different parties, and patients are an imminent part of that group. So from the design start, they've actually involved us in not only educating patients about what research is about, but also educating doctors about what patients need in research. So I think this is a very important activity I'm involved in at the moment in Germany on the leukemia level.
Yes, sure. We have established at Swissmedic a working group with patient and consumer organizations just a year ago now. It's a pilot which is running for 2 years. The first experience was that we were getting quite skeptical views, like if we are establishing just another chatting club, if it is going in this direction. But now that it is running for almost 1 year, we get positive feedback, not only from the members of the working group, but also on from a political level. And yeah, this is encouraging.
Well, in the United Kingdom, I guess we're very well placed around patient involvement because all of the devolved administrations have a statutory responsibility around involving patients in designing and planning services. In Scotland, for example, we have the Scottish Clinical Dementia Research Network, and that's an opportunity for patients and families of people who have dementia to become involved in research and to have assistance to ask questions about clinical trials and to make informed decisions about how they want to be involved and whether they want to be involved and how we take things forward.